To date, the Ministry of Health for St. Lucia, we have not received any confirmed cases of the Zika virus disease in St. Lucia. We've been sending samples to the Caribbean Public Health Agency on a weekly basis, but to date, all of the samples that we have sent out have been negative for the Zika virus disease. The Ministry of Health, we continue in our preparation and response to the Zika virus disease because, as you may be aware, the virus has been confirmed in all of the neighboring islands to St. Lucia. So we continue our campaigns on the community level with our stakeholders such as the Solid Waste Management Authority, the St. Lucia Hotel and Tourism Association, and the constituency councils. We have been doing intensive campaigns on the ground, working at the community level to eliminate the breeding ground of the Aedes aegypti mosquito. To date, we have had campaigns in the Vieux-Fort North area. We've had campaigns in Dennery. We've also had campaigns in the Babonneau area. And with support of the Hotel and Tourism Association, there's also been campaigns in the Gros Islet area. So we are continuing on the ground to ensure that all of the different communities have been, that we work closely with them to reduce for source reduction on the level of the ground. We have also brought up the date of our intensive annual Vector Awareness Week, which we normally have between May and June. We'll be having that for the week of the 14th of March to the 19th of March. And apart from the awareness that we do during that week, we'll also be launching a school poster competition. We're working closely with the Ministry of Education to use the students as well to support the message to ensure we can tackle every single household on the island. We'll also be having a motorcade and marches in different communities as well during that week, just to increase the awareness, because we have to keep on high alert. We have to keep, even though we have less rain, we have to ensure that we reduce as much as possible the breeding sites of the Aedes aegypti mosquito. We want to reduce the impact of Zika as much as possible on the island as we have. We also continue with the Environmental Health Department, the house-to-house entomological surveillance, and also our targeted fogging that we do in areas with high mosquito indices. So we continue on that level. We also continue working quite closely with our regional partners, that is the Pan American Health Organization, the Caribbean Public Health Agency, and the Organization of Eastern Caribbean States on a regional level in terms of continuous updates, continuous planning on a regional level in terms of reducing the impact of the Zika virus. And as the public would be aware by now, it's the same Aedes aegypti mosquito that causes the dengue, that spreads the dengue, that is the same vector which spreads the dengue virus and the chikungunya virus. So by all of the measures that we do for Zika would also assist us in reducing the impact of the dengue virus and the chikungunya virus. But of concern for us with the Zika virus is the associated neurological complications that a lot of research is still being done, but we have also strengthened our secondary care facilities in terms of the surveillance for both microcephaly and for Guillain-Barré, so that if we do have an issue, we'll be able to pick it up early. And that's one of the important aspects, the surveillance. We have done the training for our healthcare workers, both at the community level in terms of the community health centers and the secondary level at the different hospitals, so that our physicians are able to diagnose early. They're able to diagnose the disease early and also do the necessary in terms of sending the samples over to our lab for confirmation. So we are very grateful. The response on the ground to the public has been very good so far. We are asking the public to continue working closely, and all of our stakeholders continue working closely with us in terms of monitoring your premises, monitoring your drums in and around your home for mosquito breeding. We're encouraging the public to continue reducing the breeding ground of the Aedes aegypti mosquito, because we really need the cooperation of the public so we could reduce the impact of the Zika virus.